Hi everyone, I'm Dr. Urvashi Barbhaya, your physical therapist. Welcome to my channel. If you haven't subscribed my channel yet, please go below. Press the subscribe button to never miss any updates. Today I'm going to talk about elbow pain, its causes, symptoms, and exercises to resolve the pain. What's the most common cause of elbow pain? First is tennis elbow. It is inflammation of the tendon on the outside, which is the lateral epicondyle of the elbow, due to overuse of the wrist extensor muscles due to repetitive wrist extension movement. It's most common in professions such as tennis players, construction workers, plumbers, painters, and desk jobs. Second is golfer's elbow. It is inflammation of the tendon on the inside of the elbow, which is the medial epicondyle, due to overuse of the wrist flexors due to repetitive wrist flexion movement. It's most common in golf players, tennis players, and construction workers. The third is commonly known as student's elbow. As the name says, it's most common in students due to constant leaning over or putting pressure onto the elbows, which gives rise to bursitis, which is inflammation of the bursa over olecranon area, right here. Now, the least common causes of elbow pain are muscle strains, sprains, trauma to the elbow, osteoarthritis, and rheumatoid arthritis. So, what are the symptoms of elbow pain? Pain, swelling or tenderness in lateral epicondyle area, medial epicondyle, and olecranon area. Stiffness, limited range of motion, sometimes also associated with tingling or numbness due to involvement of the nerve. If you have any of these aches and pains, and associated with this you have decreased strength in your grip or reduced muscle strength in any of the forearm or wrist muscles, these exercises are for you. So the first exercise is biceps curl. For that, you have to make sure that you stabilize your arm by the trunk and then just bend the elbow. Okay? If this motion is pain-free and you have no difficulty while doing this movement, you can add a dumbbell or a bottled water or a food can to help you strengthen your biceps muscle, which is this muscle. Make sure the arm is stabilized and you're not doing this. Sometimes if the weight is too heavy, patients tend to do this to compensate. But try not doing that. If you cannot stabilize your arm by the trunk, use your other hand to use and stabilize it. Try this 15 repetitions on one and then the other side as well, 15 repetitions. Now, the second exercise is triceps curl. For that, we are going to stabilize our arm here and then just extend the elbow. I have seen a lot of patients doing this movement, but I have to correct them all the time. So, it's just you have to stabilize your arm like this, okay, and just straighten your elbow. If this is a pain-free movement and you have no difficulty, again, use anything like a dumbbell, bottled water, can, anything available in your house that should help you strengthen your triceps muscle, which are these muscles. The same as well on the other side. 15 repetitions, both sides. Now, the third exercise is forearm supination and pronation. So for that, again, the arm is going to be stabilized by the trunk. You can hold on to the elbow here if you want, and then just palm facing towards the ceiling is the supination movement. Come to the neutral and then palm facing down is pronation movement. If you have limitation in any of these movements, you can use your other hand to give a little overpressure. Again, the same, a little overpressure such that you feel no pain. Same on the other side as well. Now, if this movement is pain-free and you have no difficulty, we are again going to use a weight. Stabilize it. Move it nice and easy. If this becomes a little difficult, you can also hold it here. This is going to give you a little bit more resistance. Now, the same with the other side as well. 15 repetitions for each movement and each side. Now, we are going to do wrist exercises. For that, we'll be needing a pillow just so that we can stabilize our forearm and just move our wrist. Okay? For that, we're going to make a fist, not too forceful, very gentle, and then move the wrist in upward direction. So this is wrist extension movement. And now the same with the other side. If you can notice, it's just my wrist moving and not my forearm. Again, you can use any weight. Do 15 repetitions each side. Now the second movement for the wrist is wrist flexion, which is again you're going to make a fist, move the wrist. This side, when you're doing wrist flexion, make sure the palm is facing towards the ceiling and you're moving the wrist in upward direction. Same for the other side. Same, you can do it with the weights as well. Now, we're going to do radial deviation and ulnar deviation. For that, your palm is going to face sideways and you're going to make a fist. You can even do it this way if you want. I prefer it this way. And then move the wrist such as the thumb is pointing upwards and then move the wrist downwards. Make sure you're not moving your forearm up and down. No, the forearm is well supported onto the pillow. I'm just moving my wrist up and then down. The upward motion is called as radial deviation. The downward is known as ulnar deviation. So we'll do this 15 repetitions each direction. The same for the other one as well. You can do this with the weight as well, in the same manner. Down and up. Now I'm going to demonstrate to you a technique called as cross friction massage. So find the point which is the most tender. Use 2 fingers, pulp, or you can use the pulp of the thumb. Try finding the spot which is the most with tenderness and then go there with the pulp of 2 fingers and then go back and forth. While you're doing that, make sure you're not just going superficially because then you're just moving the skin. You have to apply a little gentle or moderate pressure and then just go back and forth. You can keep doing this for 2 to 3 minutes. Also, you can go below a little. You will find the muscle belly here, which is most commonly found painful in the patients. And then find the spot which is most tender and go back and forth. You can also apply a little biofreeze or icy hot or balm just so that it's more effective. Apply it a little and then do the massage for 2 to 3 minutes. It's going to help you reduce the pain. It will increase the blood circulation. It will prevent adhesion formation around here. And it will help in healing the tendon faster. And when you do it on the muscle, it will also help in improving the flexibility, reducing the muscle spasm and the pain as well. Okay, so we'll do this 2 to 3 minutes. You can also go in circular motion like this. Now, I'm going to demonstrate some wrist stretches for you. For that, I want you to move your arm in this position. Point the palm of the wrist towards you, such that you will feel a stretch right here, if you can see it. If you feel the stretch, a gentle, good stretch. Remember, no pain. We're going to hold this position for 30 seconds and going to do it 3 times. If you don't feel stretch in this position, use your other hand to give a gentle overpressure. You will feel the stretch. We'll do the same with the other side as well. Remember, 30 seconds hold and 3 times. Now, the second stretch is for the wrist flexor muscles. For that, you're going to put the arm in this position, face the palm towards the other side, and then give a gentle overpressure. If you feel the stretch in this position, just like that, hold that position for 30 seconds. But if you don't feel it, then give a gentle overpressure. Make sure there's no pain. Again, we'll do this for 30 seconds and 3 times. Now, there's one more exercise that is going to help you with increasing the strength in your grip muscles, or it will help you in improving the mobility and the dexterity in your hands. You can take a towel and then you can bring the wrist. So, if I want to increase the dexterity or grip strength in my right hand, I'm going to hold this with just my left hand and then move my wrist in this direction such that it's a pain-free movement. And then do the same with the other side as well. Okay. These exercises can be done twice a day. Just to support your elbow, you can also use a brace and try to avoid the repetitive motion of your wrist to reduce the pain or to reduce the overuse of the muscles. If you have any acute tenderness or swelling in any of these areas, as I mentioned, lateral epicondyle, medial epicondyle or olecranon area, you can take an ice cube, massage it over that spot for 3 to 4 minutes. You can use anything with it like icy hot, biofreeze, anything. Just massage it over there. That will help you in reducing the pain, tenderness and swelling in those areas. If any of these exercises increases your pain or gives you pain, stop doing these exercises. If you have any aches and pains or you want me to discuss any exercises for any conditions, please write it in my comment section and I will try to come up with a video soon. If you liked my video, please like, share and subscribe.